Hi everyone, my name is Brittany and I'm sharing my open heart surgery experience with you in a 5-part series. This is the last part, and because caregivers are so crucial to your recovery, I thought it would be a great idea to film a video with caregiver tips and tricks for when you go through your surgery. Let's get started. Tip number 1, remember that this is a full-time job to start out with. You will have to do things from turning on light switches to putting our shoes on to moving something on the coffee table 1 or 2 inches so that our range of motion now allows us to pick it up. And also remember that we are exhausted. Our bodies are working so hard to recover that all of our energy is put forth to that. So that means conversations are more difficult than they normally are, and thinking is a lot more difficult than they normally are. So if your patient responds with a simple no, or they don't look appreciative, know that they are, but they just don't have the energy or the capacity to show their appreciation at this time. I guarantee you they are so thankful that you are there, because they and I couldn't do anything those first few weeks out of surgery. The second thing that I want to give you a tip on is remembering that our torsos are in a lot of pain. So we will do anything to make sure that our torsos are straight and stiff, so that our pain level is as low as possible. And this means not moving our upper arms, because our upper arms are connected to our shoulders, which is connected to our clavicle, which is connected to the sternum, and doing anything to not really move our upper thigh, because that's also connected to the torso, which makes moving our chest uncomfortable. Tip number 3 relates to food. So when you're in the hospital, you will be required to take one nutrition class with your patient. There they will tell you what to cook, what not to cook, what to stay away from. So when you're at home, make sure those meals that you're cooking for your patient are up to those standards. Also, when I was home, I stayed in a lazy boy chair and I did everything in that chair, including eat. So I bought a tray that I could eat from so that I could feed myself, because remember, we aren't going to move the upper portion of our arm, but I was able to move the lower portion of my arm, which meant I could eat myself if the tray was at the appropriate level. So tip, I would buy a tray, making sure that it's at an appropriate level when they are eating so that they can feed themselves. Tip number 4, have a puzzle ready for them to do. Puzzles are great for recovery because they help expand the range of motion, which is very limited starting out. And the weight of puzzle pieces is very light, so that is something that I could pick up. And it was also nice because it got me away from the TV for a few minutes out of every day. And as each day progressed on, I was able to do the puzzle more and more, which was a very relieving activity because it got me away from the TV and it helped with my range of motion, as I said before, so that I could eventually move my arm up and down and across the puzzle. Request number 5, and I can't stress this one enough, be the patient's advocate. One example is that I was being pushed in a wheelchair too fast, and when you go over the bumps, it really hurts, but I couldn't communicate that because it was too exhausting to communicate it, so I just writhed in pain and dealt with it. But if I had someone there to say, no, slow down, to the nurse who was pushing me, that would have been so nice to have. So just making sure that the patient is being in the best care possible is awesome and a very blessed thing to have in those times where we're really struggling and can't communicate those things. Tip number 6 is a bit of a weird one. It's have fun socks ready for them. So I had a couple coworkers who gave me socks as gifts before surgery, and those 3 months were pretty terrible. And the only good thing that happened was I would look down and see these dinosaur-filled socks and otter socks that made me smile on the inside. which actually brightened my day because the days get really long, especially when you don't sleep. So if you want to have bonus points, buy fun socks for your patients so they have something to smile about. Tip number 7, make sure to have a recliner in front of a TV ready when the patient comes home. So for 3 months, I sat in a recliner, unfortunately, and only watched TV. And it would have been really nice to have that there and not have to figure out what situation worked for me while I was home. It would have been nice just to go and sit in it and rest, especially after the 2-hour-long car ride from the hospital to the place where I was recovering. Bonus points if there's a coffee table or a side table next to the recliner. Tip number 8, the car ride home is really difficult. So try and have a car or any type of vehicle with the best shocks possible so that it's as smooth of a ride as possible. Tip number 9, we have to shower every single day to make sure that our scars are clean. And I don't know how by the book you will go, but it was supposed to be a clean, freshly cleaned shower, meaning my mom cleaned the shower every single day. Now that wasn't incredibly necessary in my opinion, but if you really want to check things off the to-do list, that is one thing that you are supposed to do. Again, I don't think it's really necessary. But then in addition to that with showering, make sure that there are towels at elbow height so that we can reach them. And don't be offended when the towels are on the floor afterwards, because towels are heavy and wet towels are really heavy, especially when you can't hold much weight. So I put as little effort as possible into those types of tasks, which meant the towels were on the floor, even though I wish I had the strength to hang them back up on the hook. Tip number 10, help schedule appointments and fill out all the paperwork necessary. So when we get home and post-surgery, there will be so many appointments that we have to go to and so many different types of appointments that it's so hard to keep them all straight. Especially when we're in recovery and we're trying to put all of our energy as much as possible into our body recovery versus communicating and scheduling, it's a huge help when we have help with that. And so know that that's quite a big undertaking, especially, and this goes along with being the patient's advocate, but my first cardiologist follow-up when I was home, it was for some reason scheduled with not my normal cardiologist, but I was so tired that you can't ask those clarifying questions. So to have someone there being your advocate and helping schedule and manage all of those appointments and asking those clarifying questions is a huge help. Also, I was on FMLA leave, which required a lot of paperwork and a lot of logistics of the doctor and my insurance company and this and that. And it's really nice to have help faxing these and calling these people and making sure that this is submitted by this time to this person, because that is a bigger undertaking than I originally anticipated. My last tip for you is remembering that we're in an immense amount of pain. And I know I've said that before, but make sure that what you do to your patient is okay with them. And then work yourself up from there. So maybe it's fine to touch them on the hand one week and then the next week on the upper shoulder if you need to. I say that because right when I woke up, I was able to eat ice chips, and my mom was feeding me ice chips, and I couldn't open my mouth very wide, and so my mom was accidentally hitting the spoon to my teeth. And she had such sweet intentions of trying to help me and didn't intend to hurt me, but that little tick on my teeth hurt so bad. And again, I was so exhausted, I just couldn't communicate how much it hurt. So I just dealt with it for the rest of the time that she was feeding me those ice chips. So again, she didn't have any bad intentions, but we're just in a lot of pain, and most things are uncomfortable and hurt, especially right when we're coming out of surgery. That's it, guys. Those are my 11 tips for caregivers. I also want to give a huge thank you to you, because without you, we couldn't recover. We can't do anything. And I know I'm speaking for the masses on that one. I also want to remind you that this is just my experience. I'm not a medical expert. I'm just sharing with you what I went through in hopes that it helps you with your patient through this process. That's it. Thank you all for watching. I really hope that you are now better prepared for your surgery than I was with mine. And as always, if you have any questions on anything I talked about or anything I didn't talk about, please comment with them down below because I'm hoping to make another video answering all of your questions. Good luck on your journey.